Okay, should we start?
Yes.
Today we have discussed about urinary bladder. उर्दू में ऐसे कहते हैं मसाना. So empty urinary bladder, it is a pelvic organ. It is present in my pelvis, in your pelvis. But when it is filled with urine, it comes into your abdomen thanks to medial umbilical ligament, which is attached to the apex of the urinary bladder and umbilicus. And in children, it is always a abdominal organ. Okay. Then the capacity of the urinary bladder, it is 500 milliliter normal. But after 300 ml of urine in your urinary bladder, you will have a urge to urinate thanks to rugae, mucosal folds, which will give stretchness to the urinary bladder wall. It will innervate the nerves, that most importantly pudendal nerve. You will have urge to urinate. Then we have discussed the parts of urinary bladder. We have three parts. Uppermost part is called apex. Then we have fundus or base. Then we have neck. Apex, as I mentioned earlier, medial umbilical ligament is a remnant of embryogenic urachus, and it is attached with our umbilicus. Then we have base or fundus or body of the urinary bladder. In females, it is attached with the uterine cervix and vagina. In males, upper part attached with the rectovesicular pouch. It is nothing, just a peritoneal fold. And then lower part attached with the vas deferens or semifinus duct. And before I go into detail, we have prostate gland over here. Prostate gland. It is having containing the urethra, most widest part of the urethra present in our within the prostate gland. Then we have membranous urethra. Then we have penile urethra. Female urethra is 4 cm in length, but the male urethra is 20 cm. But the size of the female urethra can go to 10 cm during vaginal delivery due to stretchness. So what does it mean? Stretchness के साथ आपकी जो measurements में change हो सकती हैं. That is normal. Vagina कहते हैं कि during sexual intercourse अपनी normal length से भी बड़ी हो सकती है. Then neck of the urinary bladder is most fixed part because we have tubo-prostatic ligament in males, and it is present just above the prostate gland in males and above the urogenital diaphragm in females. And then we have talked about this trigone. We have detrosal muscle present over here, responsible for urination. And most importantly, the neck of the urinary bladder is highly abundant with alpha receptors. Alpha receptors, as I told you, is related to the sympathetic nervous system. When you are having sympathetic nervous system, this alpha receptor will be stimulated, and this part becomes constricted and you cannot urinate. But in parasympathetic nervous system, there is no activation of the alpha receptors and you can urinate. Right? For example, when some German Shepherd is just behind you, you are having parasympathetic or sympathetic? Sympathetic. Now the alpha receptor will be stimulated and you cannot urinate at that time. So in prostate, we have a benign prostate hypertrophy after every 60 years of age for every human being. Obviously in males, not in females. We have benign prostate hypertrophy without any pathology. After 60 years of age, the size of my prostate and your prostate will increase in size. Due to the enlargement of the prostatic size, it will obstruct this urethral opening. Then we will have a dribbling and urine incontinence. अक्सर आपने सुना होगा, बाबे होते हैं 60 साल से जो ओल्ड जो कहते हैं पेशाब रुक के आता है, जल के आता है, दर्द होती है. Why? Due to the enlargement of the prostate gland, they will obstruct this urethra. Then we give tamsulosin drug. It is alpha antagonist. It will relax the alpha receptors and urethra will dilate, and it will help that patient to urinate normally. Okay, then we have discussed about this superior part of the urinary bladder in females. In males, it is covered by peritoneum, which is attached with the sigmoid colon and ileum, last part of our small intestine. In females, not covered by peritoneum but devoid of peritoneum, it is only having a vesico-uterine pouch. Anterior to the urinary bladder, we have pubic symphysis. What is pubic symphysis? It is a type of joint. Which type of joint? It is a cartilaginous joint. Like we have three types of what is joint? The junction of two or more than two bones which may or may not produce movement. F, S, E, it is structural classification. F for fibrous joint, immobile joint, no movement, synastosis, synarthrosis, your skull bones or your gymphosis, joint between your teeth and your gums. Then F के बाद था S. S for synovial joint. Every synovial joint having a capsule, having a synovial membrane, having a synovial cavity. In between the cavity we have a synovial fluid. We have condylar joint, saddle joint, ellipsoidal joint, pivot joint, hinge joint, ball and socket joint and plane joint. These are the parts of examples of synovial, freely mobile joint or diarthrosis. Then we have C for cartilaginous joints, slightly mobile joints. Example is your pubic symphysis. During delivery, we can show some movement. Posterior to that, we have superiorly we have the obturator internus muscle, and posterior inferior to the urinary bladder we have levator ani muscle. As I mentioned earlier, this is the most important muscle making the floor of the pelvic cavity. So whatever the pelvic organs present in your pelvic cavity, in my pelvic cavity, thanks to levator ani muscle. अगर हमारा ये floor थोड़ा सा कमजोर हो, हम सारे धड़म से नीचे गिर जाएंगे, ऐसे ही है ना? So if there is any problem with the levator ani muscles or any nerve which is innervating the levator ani muscle, you will have a vaginal prolapse or rectal prolapse or all the pelvic organs will come outside of your body. So levator ani muscle making the pelvic floor. And then we have arterial supply to the urinary bladder. In males we have superior vesicular artery and inferior vesicular artery is a branch of internal iliac artery. And obviously the drainage of superior vesicular vein and inferior vesicular vein into the internal iliac vein. In female we have superior vesicular artery, uterine artery and vaginal artery. Also are branches of internal iliac artery. Again drainage of these veins like vaginal vein or uterine vein or superior vesicular vein into the internal iliac vein. Then vagina, I mentioned hymen. Just like rugae, hymen is also a mucosal fold of vagina. Present by birth in females, not in male, because we don't have vagina. Am I right? Yes. So in female it is a vaginal mucosal fold trying to obstruct or close the vaginal vault in order to prevent any infection. And before I forget this trigone, this is the significance I told you. We have a trigonal shape between ureteral opening and urethral opening. We have an interureteric ridge. And this is uretero-urethral ridge, and there is no rugae formation over there. Most significance or importance of this trigone, it helps to prevent anti-peristaltic movement, or there is no chances for urine to go upside into the ureter or into the kidney also. Same is true with internal urethral sphincter also. They are fully developed in males. And we know we have vas deferens and duct deferens. They are opening in the prostatic part. But if there is any problem with the internal urethral sphincters, your semen may enter into the urinary bladder. So nature developed internal urethral sphincter in males. So there is no retrograde ejaculation or upward going of this semen into your urinary bladder. The semen must go to your penile part and to the external world. So that was it for today's class, urinary bladder. Tomorrow we will discuss about urethra, male urethra and female urethra. Male urethra is for 20 centimeter, 3 centimeter prostatic urethra, 2 centimeter membranous urethra and 15 centimeter is penile urethra. Female urethra is 4 centimeter length, but the length can increase up to 10 centimeter during normal vaginal delivery. And what is the narrowest part of the urethra? What is the most dilated part of the urethra? What is the most common place for any kind of pathology of the urethra? What is catheterization? What is Foley's catheter? We will discuss tomorrow, all the clinical things.
Okay.
So do you have any other question? Thank you for your attention.